You know, today it is time for our Making the Rounds segment. We're going to be learning more about osteoporosis and osteopenia, where you can go for those diagnoses. So we have nurse practitioner Sarah Goode in the studio now to talk about both of those. So first off, what is that?
So osteoporosis is a disease. It causes fragility in the bones, it causes a thinning of the bones, and it puts patients at risk for fractures from minimal trauma, say falling from the ground level. Sometimes in very severe cases, something as simple as coughing could cause some types of fractures.
Oh, wow. Okay, and who's at risk of having that?
Well, you know, the low-hanging fruit answer, I feel, is postmenopausal women. 1 in 2 women end up with a fracture in her lifetime. It does affect men as well, and oftentimes they're forgotten about because we think it's solely a female disease. But men are affected, and about 1 in 4 men end up with a fracture in his lifetime, typically later in life than women. And typically once the men end up with their fracture, say a hip fracture, the mortality is higher in men because it happens later on in life.
And in terms of, you know, what to look out for, are there certain signs and symptoms?
Well, that's a very good question. A lot of patients misunderstand what osteoporosis is in regards to how it differs from osteoarthritis, 2 totally different diseases. There are no symptoms of osteoporosis. It's one of those silent diseases. You don't feel your bones getting thinner. The first sign is a fracture or a break, and so it's very important to be proactive and screen for this disease to prevent it from happening.
Yeah, it's almost a double whammy because as you get older, it's harder to heal.
Right.
And those fractures can lead to other things as well. Can you talk to us about, you know, more on that and how these illnesses can have an impact on people's life?
Certainly. Probably the biggest impact I see is a decrease in independence in patients and a decrease in their overall quality of life. Most of the time when these patients end up with, say, a hip fracture, 30% of the time they're in a nursing home, or 30% of the time they die. You can die from a hip fracture. And if you are lucky enough to survive it, your level of functionality post-fracture is oftentimes not the same as before fracture. And it's very depressing as a patient to have your life changed so quickly from a fall. And it's very upsetting to see it unfold in the clinic space as well. So
there are no signs or symptoms, you were saying, but there's an evaluation you can have done, right?
Correct. It's a bone density screening. It's our gold standard. It's a non-invasive procedure. It's similar to an x-ray. You lay on a table. We evaluate the hip bone density, the spine bone density, sometimes the forearm. We can also tell from the same test the quality of the bone you're building. So not only are you building good bone, but is it good strong bone? Obviously you want to have strong bone because, you know, the stronger the bone is, the less likely it is to fracture. And so we can test this in our office very easily. It takes about probably 10-15 minutes to do, and we get the results instantaneously, and we can go over them with you.
Sounds good. A lot of information. Thank you so much for sharing that.
Of course.